The presentation tonight is intended to be fairly high level. We're just really going to explain various principles to you, and we just like your feedback on it. Now, this is to help us to frame a consultation process which we will be starting in about 2 weeks' time. So this is very much to help us to help you going forward. Now, there's nothing set in stone. We are going to actually work our way through it. So tonight, what we want to do is to set the scene, explain the financial pressures that we're facing as taxpayers and through taxpayers the government, explain these issues and how these might be dealt with in the future. And then once we've done that, we'll be asking you to give us your opinion. As all parts of our government and its services ought to be operated in a simple and understandable way, and I'm not going to dwell on that point. I would say that it has to be better to be in work than on benefits during your working life if your health and physical circumstances allow. I would suggest that these principles should be behind everything in our social security system, but that system needs to change, in my opinion, and I'll now start to explain why. The island's current benefit system for both working age and those in retirement are closely based on the equivalent UK systems. This means that they are designed for a country which has got a different demographic profile from the Isle of Man, different size of population, and it's got different needs. One of the problems that we face with the UK and all developing countries and developed countries is that a bigger proportion of our population is now older. As medical advances has moved forward, people are living longer. So what we need is a scheme which is fair, which is relatively easy to understand, which is affordable in the longer term. And what we need to do is to look and see how that can be achieved. Now, I've been accused in some quarters of being a shroud waver. Now, this is from a slide of a presentation that I delivered as the Minister for Health and Social Security in 2008. Now, you can see from that that very little has changed. Our state pension scheme operates on a pay-as-you-go basis. So, in other words, those people who pay in fund those people who get money out, as it were. But as we move forward, there'll be fewer workers paying in to fund the payments for those who are in retirement. Now, going back 10 years, we had 3.8 people paying in for every one person who was drawing out. Within 20 years, that's going to change to 1.9 people paying in for every one person taking out. So what I would suggest to you is that the sooner we start, the better. And by leaving it, it's going to be more difficult to address. So let's have a look and see what's best for us, for our children and our grandchildren. What we have at the moment is a very complicated system. The state pension is made up of 6 different elements, all with different rules. It's hard for anybody to understand, and it's very difficult for my colleagues to administer. And if you want to plan for retirement, you need to know what you can expect in retirement. At the moment, it's very difficult for the average person to actually work it out. However, the benefit system is left in the shade by the benefit system. It's even more complicated. 21 different elements, some means tested, some not. Some dependent on the level of contribution, that's what you paid in over your working lives, and some not. So, as I said before, we're operating a system which is designed for the UK, not the Isle of Man. One of the big issues we have is affordability. Most of the benefits are funded, that's paid from the National Health Insurance contributions. So today's workers pay today's benefits. And the biggest cost of the benefits we have at the moment is the state retirement pension. In the last financial year, the total cost of that was £125 million. Now, that's the basic state pension. On top of that, there's the Isle of Man pension supplement, which is a further £35 million. And we're currently taking more out of the NHI fund than we're paying in. The latest report that we've had predicts that the fund will run out in 2047. Now, it started in 2013. We don't have the capacity or the expertise to actually do this in-house. So they were instructed to carry out a full review of the benefits of the National Health Insurance Scheme, which operated in the island. What I do want to make clear is that doing nothing is not an option. Putting our heads in the sand isn't an option. We'll have to make a change if we're to have a financially secure future on the island. Now, these are the various forecasts. I apologise for this. It's a very busy chart. The dotted lines are where the actuaries, that's the people who calculate when a fund will run out, feels that the fund is going to run out. If we carry on, no change, it's 2047 they feel the fund will run out. Now, the dotted lines are expenditure, is the top line, income is the bottom line, and not surprisingly, the fund drops out. With the changes that we're looking at, the solid lines at the bottom are the income and expenditure, and there's not a great deal of difference between them. The blue line is the income, so it's slightly higher going along than expenditure. But the effect is this red line, which is the balance of the fund, stays positive. And at the end of that period, we would have a fund which would be the equivalent of 2 years' outgoings. So we feel that that's a prudent approach going forward. Now, you asked why didn't we do something sooner? Why didn't we move it sooner? Now, we've relied on actuarial advice, professional advice, and every 5 years there's reports prepared for the government. So the first one was 2002, and at that time they estimated it would run out in 2066. 5 years later, it's moved down by 7 years. 5 years later, it's moved down by 5 years, and again, it's moved down by 7 years. So you can see the trend. So what we have seen is that the forecast time when the fund is going to be exhausted has fallen by nearly 20 years over the period of those reports, and that's just over a decade. So the report confirmed our high-level concerns, but there isn't a solution. If we act and act soon, it'll be certainly much easier to cover. And CI65 made a series of recommendations covering the state pension and national health insurance, saving for retirement, working age benefits, and we, myself and Malcolm, will go through each one in turn. What I would say is that it's likely to affect our reciprocal agreement on social security with the UK, but it's entirely separate from the health reciprocal agreement that we've got. You shouldn't think that the two are connected. They're entirely different. So, do you feel that action is needed? Strongly agree, agree, disagree, or strongly disagree? So, I'll hand you over to a fresh voice now. I'll ask Malcolm to step in. Thanks.
We're going to start going now into more detail about the elements of the social security system. We'll try to keep it jargon-free again. Do feel free, if you think that I'm starting to talk in complete gobbledygook, to stop me. We've tried to keep it in English rather than techno-babble, but you never know. So the first thing to look at is the state retirement pension. And CI65, in addition to reviewing all that we have, put together what they called, as we were working with them, a shopping list of potential changes that we could make in the Isle of Man. And I think the overarching theme the Minister's already covered is, do you want to grab something for the Isle of Man that's appropriate to our community and that would be long-lived in the future? And again, as the Minister's just been saying, that would mean, to a degree, a break from the UK, which we've been locked into since 1948 in terms of the reciprocal arrangement we just talked about. And the shopping list included things about pensions, things about national insurance contributions, things about workplace pensions, and things about general benefits. So we're going to go now into each of those in detail. So this is the concept they put to us, which you could have a new Manx pension. It could be based on a very significant increase in what the state retirement pension is now, so it could be £180 a week. But interestingly, the gentleman who was saying earlier that the changes that we've seen in the amount of time you need to build up a full pension used to be very high when state pensions started. Then they fell really quite a lot down to the minimum of 30 years, which was introduced by New Labour in the late 1990s, and the Isle of Man followed that. The consultants suggested that at the beginning of building up a pension, or overall I suppose, that you ought to have a certain amount of contributions before you got any pension at all, which is what that third point there is, that you'd need to actually have 10 years worth of contributions in the bank, so to speak, before you got a pension. So 45 years for a full pension, 10 years to get any pension at all. In terms of guarantees for people who are pensioners, breaking this idea of the three ways of looking at it, which the Minister was saying earlier, where at the moment, come hell or high water, there are quite significant increases, matching it in the Isle of Man with average earnings increases, which seems perfectly fair and perfectly logical and perfectly understandable, but that's what's being proposed. Okay. Now, in the UK, if we look at this, is what CI65 have proposed to us. In the UK, they're talking again, similarly, this comes in next year, a single-tier pension scheme. Their flat rate is expected to be in the region of £155 a week, 35 years of contributions to get a full pension. They've not actually confirmed yet how they'll do annual increases. The retirement age increases, which CI65 have proposed to us, the UK realises they need to make the state retirement age go to an older age, but they've not been quite as aggressive as this. And the idea of having some flexibility around your state retirement pension, the UK haven't embraced that. Now, we get to some possibly even more controversial bits, apart from the first one. So as said earlier, clearly one of the key things here is that people who are currently pensioners should have no fear that anything's going to be swept away. So the concept really would be that you would have the existing pension, and that continues for as long as folk are drawing the existing pension that they have. Then you start to build a new pension, and that will come in parallel, and eventually you get to a point through nature where you have everybody on the new pension. But what 65 have said to us is that one of the elements within the 6 elements of the pension that the Minister was saying earlier probably needs to go over a gradual period and carefully done is the pension supplement. So the flat rate that we were saying just now, that £180 a week, the concept there is based on not including a pension supplement. So that is the pension, the state retirement pension. That's the single unified one.